We talked a lot about the importance of protecting essential workers here in the state of California, protecting essential workers from the ravages of this virus, and to maintain that structural integrity of an economy that disproportionately relies on those essential workers. I made this point on Friday. I'll make it again today. While we see positivity rate in the state of California growing modestly, we're seeing total number of cases certainly growing, a number of people losing their lives, and I'll talk about that in a moment, also growing. It's not happening evenly in every part of the state. There's certain parts of the state, certain regions in the state, and certain sectors of our economy that are disproportionately impacted by the transmission of this virus. We're here talking today about the Central Valley, 8 counties that have R effective rates. Dr. Galley will remind you what R effective is in a moment when he speaks. R effective rates north of 1%. We have 8 counties where we're seeing an increase of infections. We have positivity rates in the Central Valley on the low end of 10.7%, in Fresno, Tulare, and Stanislaus, on the higher end 17.7% positivity rates. So you get a sense of the challenge we have in the 8 counties making up the Central Valley, disproportionately being impacted currently by community spread, and by spread happening disproportionately with essential workers, disproportionately in the Latino community, disproportionately impacting congregate settings, continuing to be vigilant around skilled nursing facilities, correctional facilities, and the like. That's the area of more of our laser-like focus in terms of our targeted interventions, in terms of our resource allocation, and in terms of our transparency and ultimately accountability to partner with organizations, both not only at the state level, local level, but also at the federal level, to provide relief and diminish the spread and transmission of this virus. So today we're announcing $52 million investment, new dollars that will be put into the Central Valley, into the 8 counties to improve our isolation protocols, our quarantine protocols, our testing protocols, and to enhance our healthcare workers by providing more support as well as more personnel. $52 million that has been provided to us through a grant we received from the federal government, $499 million CDC grant, of which the first dollars we're now distributing, 52 again in the 8 Central Valley counties, focusing and targeting on improving testing, not only providing more supplies and supports, but time to testing results. And you'll hear a moment more from one of our co-chairs of our testing task force to talk more specifically about some of our renewed efforts in this space. But these dollars we think are timely. These dollars certainly are critical and important, and they will build off local infrastructure that's already in place. What's also in place, deeply ingrained in our mindset, is the example of what occurred in Imperial County and the work we've been doing in Imperial County now for a number of months to address some of the community spread that really flared up there disproportionately in that county. We were able to make some improvements in terms of the transmission and spread of the virus by deploying a number of strike teams. Some of you may recall these regional unified response teams that we deployed into Imperial County. We're announcing today we're doing exactly the same thing throughout the Central Valley. 3 teams representing 3 different regions in the Central Valley will be deployed along the same lines we deployed those teams in Imperial County. I'll remind you those teams included members of the Office of Emergency Services, certainly members of OSHA, team members, Department of Social Services, as well as partners that we developed at the local level, including community-based organizations that will be helping us and supporting our efforts to truly unify our engagement, truly unify our approach and framework to mitigate the spread of this disease. We've also created at the State Operations Center, what we refer to as the SOC, a new Central Valley task force exclusively focused on the needs of the task force, or rather needs of the Valley. That task force focusing on this unified, coordinated response and focusing on accountability, again, transparency at all levels of government. And so with the new supports, $52 million of new resources we're deploying, with these strike teams, which will be deployed in every one of the 8 Central Valley counties, with the renewed vigor of what we announced on Friday related to supporting our essential workforce, disproportionately engaging our employers, not in a punitive mindset, but a supportive mindset. The work we're doing in terms of increasing the acuity of focus related to identifying and isolating and quarantining individuals that may have either tested positive for COVID-19 or have been in an environment where someone was a close contact had been tested positive for COVID-19. That through the additional efforts with our partnerships that we are establishing, we announced Friday, including Project Room Key, which is being enhanced to provide isolation space and additional supports in terms of housing vouchers, primarily hotel vouchers that we're supplementing, and increased education, more targeted engagement to not only employers but to employees so that they know their rights in relationship to sick leave and in relationship to workers' comp. We think we are in a better position this week in terms of these efforts. And so that's the purpose of today's announcement. And Dr. Galley will come up in a moment and fill in a little bit on the details and some more specificity related to these efforts as well. Let me, though, first briefly update you on what occurred over the weekend, update you on the numbers since we last had the opportunity to engage on Friday. The positivity rates in the state of California over a 14-day period are at 7.5%. Left you on Friday, we were at 7.5%. They're holding relatively strong, up 5% over a 14-day cohort. So we've been ranging from 7.4 to 7.5 over a 14-day period. I, again, remind you that's in the aggregate. And the data that I just presented you related to the Central Valley shows a different picture here in the Valley compared to the state of California. Remember, 10.7% in Fresno, 17.7% Tulare and Stanislaus, 7.5%, however, statewide. The 7-day average, which has gotten more attention, is 7.8%, but 7.5% over a 14-day period. Hospitalization numbers, as well as ICU admissions, are increasing, but at a more modest pace than we saw 2 and 3 weeks ago. You may recall hospitalization rates in the state of California when we announced a 50% growth over a 14-day period raised obvious alarm bells. Over a 14-day period, we have seen that hospitalization rate now, in the announcement, today's numbers, increase 3%. So from 50 to 3%. I left you on Friday, that 14-day hospitalization rate was at 9%. As it relates to ICUs, you may recall hospitalizations were up 50% a few weeks back over a 2-week period. ICUs were up 39% a few weeks back over a 14-day period. The numbers we have out today are 14-day numbers related to ICUs have increased 7%. So from 39 to 7 on ICUs, from 50 down to 3% on the hospitalization. So again, we're seeing a growth rate, but we're seeing a modification, a decline in the rate of growth. It is not where we need to be, but it's progress indeed. But more progress needs to be made. And again, our efforts, our focus are really to target those efforts in areas that are hotspots, Central Valley and Southern California, particularly Los Angeles region, as again, focus of a disproportionate amount of our efforts. By the way, on Friday, for what it's worth, the 14-day on ICUs was at 11%, again, down to 7% today on Monday. Related to the total number of positive cases here in the state of California, we have averaged, and I again caution looking at daily stats, both in terms of deaths and daily stats in terms of positives, because it doesn't always give you a real picture. We can run with headlines based upon data that appears relatively low, some that appears relatively high, and that's why we prefer the 7-day number. Our 7-day total number of positive cases is averaging 9,859 cases, 9,859 cases over a 7-day period. Number of deaths over a 7-day period has increased from 91, the previous 7-day cohort. The last 7 days, our average number of deaths, tragically, is 109. So the total number of deaths is certainly beginning to increase. Don't be misled. The numbers that we're announcing today are just 29 deaths. And I don't say just, because I am not naive about every one of those deaths being a loved one's lives lost and a family completely torn apart. And so our hearts go out to every one of those families. But 29 is today's reported number, but the 7-day average masks 109 average deaths per day. And I remind you, what more evidence do you need than that of how deadly this disease continues to be? How deadly this disease continues to be.